Emergency medical situations by nature are unexpected. When they happen, you're vulnerable, exposed, and mainly focused on staying alive. The cost of treatment is often not the first thing on your mind. But in the aftermath, when you finally have a moment to take a breath, you're hit with a surprise medical bill.
Those providers or hospitals will bill your insurance company. They'll probably pay something, but if they don't pay everything that the provider wants, the provider would send the rest of the bill to you.
That's Katie Keith, an associate research professor at Georgetown University in the Center of Health Insurance Reforms. Part of her work focuses on analyzing expenses called surprise out-of-network bills.
These are the types of bills that you think are covered by your insurance, you expect to be covered, and then it turns out it's not covered. The way that these sort of pop up is particularly when you need emergency care, right? Maybe you have something awful happen, you need to be airlifted in an air ambulance and you're taken to the closest hospital, or you schedule surgery. It could be non-emergency, but you do everything right. You find the in-network hospital, you pick your in-network surgeon, and then through no fault of your own, you are seen by an out-of-network anesthesiologist. And so, all these situations where you as the patient don't really have control over where you're taken in an emergency situation, or sort of who is doing things behind the scenes that you might not even know about, especially if they're out of network.
But this worry around what's in and out of network has come to an end. The No Surprises Act was passed by Congress in 2020, but just went into effect this year. It covers patients who receive emergency and non-emergency services from out-of-network providers at in-network facilities. It also protects people who receive transport from out-of-network air ambulance providers, like helicopters. Keith hopes this new act will save patients from the burden of surprise medical bills.
This shouldn't be happening anymore under that new law. I think it was this recognition on a huge bipartisan basis by Congress that patients shouldn't be left in the middle between, these disputes between out-of-network providers on one side and health insurance companies on the other, especially if you have no choice in the doctor or hospital that you're taken to.
The U.S. Department of Health and Human Services recently released a report showing surprise bills are common among people with private insurance. 1 in 5 patients who visit emergency rooms, have elective surgeries, or give birth receive an unexpected charge. The average cost of these bills range from several $100s to nearly $3,000. Keith says she's heard of an air ambulance bill for $50,000.
And the insurance company will try to help them. Sometimes your employer will try to help. But at the end of the day, I think without these new protections that we have that should address these situations, folks were just paying. And it was leading to medical debt and high out-of-pocket costs and all the sort of horror stories that anyone who's had, a medical issue sort of understands very well, unfortunately.
Even though over 90% of Americans have health insurance, 1 in 3 adults have medical debt, according to a recent survey. In 2021, a Stanford economist provided research showing that Americans owe at least $140 billion in outstanding health debt. The previously estimated amount was $59 billion short of that number. The new law prevents this number from growing even more.
So the No Surprises Act steps in and says, on the one hand, providers, you can't be sending those extra bills anymore. If there's an out-of-network bill, you need to work it out with the patient's insurance company. Go negotiate, go figure out what the fair rate is, but we're not going to ask the patient to pay that rate anymore.
Instead, patients are only responsible for what they would have paid at an in-network provider.
So it kind of holds the patient harmless and really tries to take them out of the middle of the dispute. And so my hope with this new law, again, it's new, so it's sort of still rolling out, but my hope is very much that patients don't get those bills ever. And that, again, you just have these two sort of big industries, the healthcare providers and the insurance companies, taking care of this and sort of working it out by themselves.
But not everyone is on board with the new law. Since its recent enactment, physicians and hospitals have already filed several lawsuits against the act. Many of their concerns lie in the law's rules for arbitration, a method for settling disputes.
If they can't come to an agreement on their own, the law, the No Surprises Act, included this arbitration process. So you can, sort of like going to mini court, right? You can go in and say, this is how much we think we should be paid. And the insurance company can say, this is how much we want to pay you. And you sort of work it out there. Because I think, Congress passed this law to lower healthcare costs and reduce premiums, it does threaten some providers, maybe bottom lines and some of their profits. That's especially true for the types of providers who have really used surprise billing and sending patients these surprise bills as a business model.
In a Texas case, providers successfully argued that part of the arbitration process favors insurance companies. However, Keith thinks many of the concerns stem from providers not being able to charge their same high rates.
I think the response to that is we can't have a system where there's sort of a blank check for what you can charge. And a lot of the providers who are most affected by this are some who historically charged the highest. We're talking, 400 or 500% of Medicare, really, really high rates relative to others. And I should say most providers and hospitals don't do this. So, many patients might have gotten one of these bills, but it really is from the minority of physicians and hospitals, et cetera.
Since the law is so new, Keith is still watching to see what loopholes will emerge. One area she's already noticed is the lack of coverage for ground ambulance assistance. Although emergency air travel is included, the No Surprises Act does not apply to ground emergency transport. And while she believes there will always be room to grow, Keith is happy with this first step, even with the pushback from some providers.
They don't want the government standing between them and what they can charge patients. But again, I would just say that Congress has made the judgment that there's not a blank check to charge patients whatever you want, especially when healthcare costs are as high as they are in this country. It's unsustainable. And it was time to step in and protect patients here.
Keith urges patients to continue monitoring their medical bills until all the law's wrinkles are ironed out. She says taking a close look at hospital statements will help make sure you're only paying what you owe and nothing more. You can find more information about Katie Keith and all of our guests at our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Twitter, Facebook, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
You do run into a lot of these doctors who think it's all in your head. The irony is, it is in your head, it's in your nose.
The rare condition that leaves you constantly feeling suffocated.
Then why elderly men have the highest rate of suicide?
The real risk here, it's not age itself. It's not just suddenly when someone gets older or a male that they're more at risk for being suicidal.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
And I hope that now that Americans have gotten more used to wearing masks, that we will also consider wearing these during periods of high rates of flus and colds.
The benefits of face coverings past COVID. Then,
according to some studies, the McDonald's arches are more recognizable worldwide than the Christian cross.
The global appeal of the fast food chains we frequent and love. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.